Who? Who? All right. So we are from middle school Bukasi, and I have my good friend here. I have Anza Sahel Lubis. Anza, can you hear me?
Hello, I can.
Okay, there you go.
So professional, eh?
Yes, we're so professional. We are live at our home studio, pun intended. uh, so basically, the main point about this video, we're going to talk about the tuberculosis, and especially now we're in quarantine. And I think there are similarities with SARS-CoV-2 and also tuberculosis bacteria that we can use to sort of use the same tactics that we used when we face tuberculosis when we go to COVID-19. So here goes our topics. We have the TB or not TB. It's fun. You will
Made
get
by
what-
Deno, eh? Made by Deno.
Okay, so we have certain topics that we're going to talk about here. So we're going to discuss about the TB, and then we'll explain about the background, about the pathogen, and also what is a tuberculosis and where did they begin, who found it, and etc. And we'll go to diagnosis. This is where we're going to talk about more on the what happened to the patients that catch the tuberculosis, and more on how a doctor actually tests for positive tuberculosis or negative tuberculosis, and we're going to talk about that one. Transmission, that's where we talk about how tuberculosis passed from one person to another. Pandemic, we have the history here, more on the history of pandemic and tuberculosis. And then famous story, this is quite secret. Anza actually discovered something cool, especially for Indonesian. Something extraordinary about tuberculosis in our history. So we're going to talk about that later. And then MDR-TB and XDR-TB. And so these are the two new emerging tuberculosis type. We're going to learn more about that when Anza talks about that one. And then treatments, how we treat tuberculosis patients. And then after that, prevention. This is when we talk about vaccines and whatnot. And impacts around the globe. Also in this video, we're going to cover more on the global trade, migration, and then ozone holes, global warming that connects the tuberculosis pandemic and also spread. Okay, let's get to background. Anza, take over.
Okay.
Hey,
Take control.
right.
Okay. So now I'm gonna talk about the background of TB.
Yep.
But some of you might ask, what is TB, right? It's tuberculosis. It's a disease. Where I'll show you the slide. It's a disease caused by two pathogens, which are bacteria, which are Mycobacterium tuberculosis and Mycobacterium bovis. Where these bacteria doesn't come from like magically appear like in a corner of your room, no, but M. bovis appears from raw meat that you eat or bad milk, food that are not eatable.
Yeah.
Yeah.
Food.
That's raw. That's not good for your body. So the bacteria comes from that raw meat. For M. tuberculosis, it comes from the mucus or the saliva of a person having tuberculosis. Any type of liquid that comes from that has contact with the lungs.
And this is like also the same case with SARS-CoV-2, am I right? This
Yes,
when
yes.
you're, yeah.
Because the transmission quite similar to the SARS-CoV-2 virus, and due to that, many symptoms are caused because it is first infected in the lungs, so shortness of breath and many more that will cover up later. Deno will speak about the symptoms, and this is also very dangerous. I think Indonesian should worry more about TB more than COVID-19, so, and we'll discuss more about that later because it's just so easy to spread around. But thank God we're in quarantine now, so everyone should be more safe.
But safer
Thank you, Corona.
for now.
For now. You know?
All right.
Hey, wait. Still me.
More for your slide, go.
Still me then. Wait.
Come on,
So,
don't worry about it. You're done.
Tuberculosis is actually discovered by Dr. Robert Koch here. You can see the picture. In 1882, he discovered the Mycobacterium tuberculosis, where then he received a Nobel Prize. Oh, that's
Nice.
me in the future, bro.
That will be us in the future. We found a new bacteria. Name it after us.
Okay, Deno.
Next one. Let's talk about the diagnosis. First, we got the symptoms, like Anza said before, since the primary infection infects the lung, most primarily on our upper lobe of the lung. So this, of course, causes some sort of a disease, some sort of symptoms that can do with cough. Um, Not just any cough, actually. There are two types of cough. When you're lucky enough, you might not get into a more severe cough. You might just have a hacking in your throat, and your cough may be dry, and then it will hurt your throat. But in the severe case of tuberculosis, where it infects your upper lobe of the lung, and then it infects your blood vessel in the lung, it may cause a cough bleed. Now, this is when it's severe, and you probably need to go to the hospital. Not probably, actually, you need to go directly to the hospital and get your checkup. Now, and then after that, from here, we get into a other symptoms, which is a fever. Now, normally a fever is just our body ways to sort of fend off against the bacteria or any pathogens that might attack the body. And with fever, you will cause sweat, and then as well, when you are having a fever, you might lose appetite, which is a very, very common symptoms when you're having a fever. And the effect of the loss of appetite will cause you to lose weight. That's like there. I couldn't find any better picture. Right. And the next one, we go to TB test. Anza?
Oh, so we don't know when we have TB actually, right? So maybe I have TB. Maybe Deno has TB right now.
I have diabetes.
Diabetes. No one knows, right? But there are actually two methods to know if someone has tuberculosis, the bacteria that causes tuberculosis. Where in the first method is that the mucus or the saliva of a person, any liquid that has that comes from the lungs, will be tested, will be observed under a microscope to see if there are any M. tuberculosis or Mycobacterium bovis. As you can see the picture there, there are the pictures of both pathogens under the microscope. So this is the first method. When then the second method, take control. The second method is by doing a skin test, where they will inject PPD into your skin, which is purified protein derivative, where it will nembus.
Yeah, we take into your dermis there, in the skin, and then
it will go through the epidermis, and it will be held in the dermis, where it will be left in the dermis, the small injection of the purified protein derivative, and it will last about 48 to 70 hours there. It will be left in the dermis for 48 to 72 hours to see the result of it. And what determines if you have TB is the radius or the size of the PPD, how much it will grow, how much it will develop under the time span of 48 to 72 hours. Where if it's only 5 to 9 millimeters, it'll positive in category 1, and category 2 is 10 till 14 millimeter, and then category 3 is more than 15 millimeters. Yeah, so this is the second method of diagnosing someone with the tuberculosis.
And also, you will have bad news. If you actually have positive tuberculosis, you might take another test for this one to see whether or not it is a severe tuberculosis or not, which we're going to talk after this when we go into, okay, how do I take control? There, we got to the transmission here. So there are things that we need to talk about for a minute. We need to talk about basic concept about tuberculosis, because most of the slide contains this concept, and as well to ask the question, where can they be found? Well, this was connected to Anza's first slide, where we talk about the foundation of tuberculosis, the bacteria M. tuberculosis. Now let's talk about the basic concept for a minute. So first of all, tuberculosis is an airborne disease, but it does not fly on its own. So here's a basic misconception that people have to think, as well as the COVID-19. People might think COVID-19 is an airborne disease, but well, in fact, it is not an airborne disease per se, because it needs medium to fly. Like Anza have said before, it needs mucus and also pus to fly, which is our body fluid, mostly found in our lung fluid. And then when you sneeze or when you cough, that fluid contains the bacteria, and then if it's connected to other people, the other people might get infected as well. And like in points 2, it says it needs body fluid, like I just said, from the lung fluid. And then the third one, it loves to make use of our immune immune system. We'll stick for the number 3 for a minute when we talk later on HIV/AIDS connection with tuberculosis. Now, where can they be found? So, like I have said before, more on that in the 1882 pandemic in the UK. The founder for the tuberculosis, like I said before, Dr. Ko, I might just say that as well, found the tuberculosis in the cattle, also such other animal like deer, bison, and elk. Then after that, we go into this other differentiations of tuberculosis. So when a patient is infected by tuberculosis, there are two possibilities that might happen to them. One, they might get infected by a prompt TB. Well, there's no specific name for this type of TB. You might as well say the normal tuberculosis, but I just named this prompt TB so that we can differentiate between the other one, which is the latent TB. So a prompt TB or just a basic normal TB, when you get a tuberculosis, you will show symptoms. The symptoms, like we just said before, the wrecking cough, cut cough, and all the fever and whatnot, and then you get the disease. Or you might have a latent TB or a silent tuberculosis. You won't show any symptom, but you will be a carrier, which you won't show any symptoms. You will feel all fine, and after that, without you knowing, you infect the disease to other person. But then the latent tuberculosis can be activated per se. This is how to activate the latent TB is when your immune system went down. Now, to answer the question, how can you turn down the immune system? How your immune system weakened? There are couple ways. First, if you're an alcoholic, that might turn your immune system. Or if you smoke, or you have an autoimmune disease, HIV/AIDS, and malnutrition. We're going to talk the HIV, AIDS, and also malnutrition. Now, let's go to the factors here. We have a couple of factors that influence the spread of tuberculosis. We first have migration, global trade, and then the pollution and also external factors like ozone hole, global warming, and I will explain more on that one, and also the anti-vax movement. First, let's go to migration. So, say that a person migrate from a place where tuberculosis is endemic. When a person came from a country where it is endemic, he might be a carrier to tuberculosis. Can be a latent tuberculosis or also just a normal tuberculosis. But if it is a latent tuberculosis, that would be quite dangerous because there's no symptoms and there's quite a chance that we can tell whether a person is infected by tuberculosis or not. And then when that migrate person going to the destined country and then more population in that destined country have to catch tuberculosis and then tuberculosis become endemic. By meaning endemic means there's an increase in case of tuberculosis in a country. Say that migration chain didn't end. So from that country, there's another person go to another country, from another country, migrate to another country, then it might cause a pandemic. And it will be a very, very great factor, especially for the spread of tuberculosis. Global trade. I'll take example from Netherlands and also the United States. These are the two countries that export fresh meat. And like Anza have mentioned before, it is found in the fresh meat and also morely on the fresh meat, especially cow and also other cattle animal. So the reason why we talk about the fresh meat is because a fresh meat contains water, mostly water. And water is not a pure substance, as you know. What this means is that this impure substance of water is a very great factor for the bacteria to grow, and the bacteria can stay in this fresh meat for a couple of time, and then when this meat is exported to another country, other person might get infected, and then after that cause a mayhem and pandemic in other country. That's basically the general idea for global trade. And I'll take the Netherlands and US example again for the number 2 countries that export meats, and tuberculosis has been proven actually spread mostly caused from these 2 countries. So yeah, it's a very great factors. Now on to you, Anza, for ozone holes and also global warming and such.
Okay. So the factors of TB can be from pollution, ozone hole, and global warming, as said in the PowerPoint. But I'm gonna focus more on the ozone hole, right? So ozone holes are made when the ozone layer are depleted due to the production of CFC, which is produced from fire suppression systems for aircraft and aerosols. So they emit CFC into the atmosphere, right? So it will deplete the uh, ozone layer, where the sunlight will harshly burst through and go to the earth. But this is not bad for humans. This is not bad for humans, but bad for bacteria and viruses and pathogens in general, because they cannot handle the radiation that is caused by the UV hole, the ozone hole. And as pictured in the picture in the PowerPoint, and where the CFC is the chlorofluorocarbon, where it can kill bacteria, right? So this is good, but the ozone holes can be seen, can be the strongest ozone hole is in Antarctica, where in the South Pole, where it will only help there. But here, like in our own country, uh, CFC is not that much, like not as Antarctica, the ozone hole. So it is not as strong, so it will not help us as much to kill off the bacteria, the pathogens of tuberculosis like M. bovis and M. tuberculosis. So, in conclusion, in Indonesia, the ozone hole would not help because it is not as strong as the one in South Pole in Antarctica.
It's like a win-win situations there. We might get ozone hole, bacteria died, but we also died. All right. Are you done? But
Yes.
it's the ozone hole.
Go ahead. No?
All right. So we got to the anti-vax movement. It's quite irritating, but okay. So basically, there are some. I'm not attacking parents or whatnot, but I'm just saying the majority as parents don't believe in such vaccine. They are having doubts on the vaccine that they're given, even though they have been proven that vaccine won't cause autism for their child. It's just a common myth. They will actually basically what they were thinking is that vaccine will cause damage to the genetic. Though it might possible, but the chances are very low, and it's not been proven yet. Might not be proven. I might be wrong, but you know. So they chose not to take the vaccine, especially in tuberculosis. When we're talking about tuberculosis, they don't take the BCG vaccine, which will Anza explain later. So they chose not to give the vaccine to their children. Now, unvaccinated children here is like an open door for the tuberculosis to spread. So without more people not being vaccinated, then it will be easier for the tuberculosis, especially tuberculosis, and also Ebola to attack an infected person. And then after that, like I said before, the cycle continues. Person infected a person, and then another person infected another person, cause endemic, more, and then cause global pandemic, just like SARS-CoV-2. Now, let's talk about the pandemic's history for tuberculosis. So first we get the World War. So I found this book online. It's called Dr. Danger Forward. Now this is a book written by, Robert Tone. So in this book, it talks about one person named Terence Nunn. He's a real person. He was a frontline in the commander of the UK Army. And then after that, he went home from the war. He talked about how a soldier during the World War only eat one meal a day, and that is a meal ready to eat, or MRE. And then in MRE, they basically just have this is the entire package for their daily consumption. Basically, that small container is the only thing that they will eat for a day, and inside there it's nothing much. It's just basically some crackers and then a cup, like a sack of coffee, cigarettes, and then biscuits. And even if they're lucky, they will get meat, but rarely. And imagine taking that consumption for one day only, and then you have to go physical fight and go to war for 2 years. And this is the effect. This is from the U.S. Army. Its name is Corporal Noel Hovenberg. This is his state of condition 2 years after just eating MRE and then going to a war straight. And then in the book here written, Dr. Danger Forward, he is diagnosed with a thing called malnutrition. And at that time, soldiers didn't really understand more the medical things that they help, because all they think about is the war and to protect their country and whatnot. So the doctor diagnosed him with malnutrition, and this is actually a very major step forward for the spread of tuberculosis, because then we'll have a tuberculosis. This is actually taken from the war during the World War II in the UK. And then it's basically frightening. Most people will get malnutrition and uh, get tuberculosis. Like I said, from the basic concept that we had before, tuberculosis love to play with our immune system. Malnutrition lower down your immune system, and thus tuberculosis will be easier to spread through you. And sorry, infect you, and then it will affect another person. And then we have the HIV slash AIDS. Now, during the 1950s to 1980s, an HIV and slash AIDS have a global pandemic. But I will not talk more about this. I'm sure the other groups who discuss HIV slash AIDS will discuss more. But this is how HIV basically works. The human immunodeficiency virus attack your T cells basically by sort of like hijacking their replication system. Instead of replicating the T cells will replicate the virus, and then that virus will weaken your immune system. And then I have this graph on the internet, and I'm just going to explain briefly here. I'm not going to go detail. So the red one is called for the CD4 count. The CD4 is basically your T cells, and the T cells is basically part of your immune cells. And as you can see, and then the blue one is your HIV count. So as the HIV increase, and then the CD4 counts decrease. So basically, what happened was when you get infected by the HIV virus, your immune system went down, and while in the end you will get hijacked by the HIV. This turning down and this lowering of your immune system will affect how tuberculosis affects you. Like I said before, we're going to go to we call the concept here. Look up 2.3. It loves to make use of our immune system. When our immune system is down, especially in HIV and AIDS, so in HIV, tuberculosis will infect your body. Now let's not get mixed up here. AIDS is basically the disease that is making use of the HIV virus. HIV virus is sort of just like making space for the AIDS to grow. HIV lowering down your immune system, and AIDS, which is the acquired immunodeficiency syndrome. The acquired immunodeficiency virus disease. Sorry, my bad. It will infect your body. And then here's the thing. The tuberculosis is actually it's a common disease of AIDS that making use of the HIV. So it's basically quite horrific to see that. Also, part of it, there's actually a graph. I didn't put it here, but basically when the HIV/AIDS pandemic increased, the number of tuberculosis also increased gradually. So there's like a connection between them. All right, next one. We get to famous story, Anza.
Okay, wait. I control. Okay. So, and the famous story that Deno just told about the war, right? War stories. World War II stories, right? But our national hero who fought for our country actually died due to said disease. And that person is none other than General Sudirman, where he died in January 29th, 1950 in Maglang due to tuberculosis. Where there are not many articles about how General Sudirman got, but it's probably the same as how all other soldiers got tuberculosis in that period of time. Like Deno said before, they have malnutrition where they don't have much nutrition, no protein to increase their immune system. So their immune system are low, and tuberculosis, the pathogens of tuberculosis can infect easily to your lungs, the first infection point. And the funny fact is that Jokowi, our president, just known that General Sudirman got tuberculosis in the Gerakan Maju Bersama menuju eliminasi TBC 2030. And I quote, saya juga baru tahu, ternyata pahlawan besar kita General Sudirman, beliau meninggal karena TBC. So now Indonesia is more aware about TBC, and there are more actions toward TBC prevention, and that's a good thing that Corona happened, so there's less interaction between people, so there will be less chances of anyone getting more tuberculosis. And another fun fact is that actually Habibie, our third president, had got TBC but is cured due to he being schooled in another country. Okay, and that's it for the famous story. Now, oh, still me, yeah.
And the MDR-TB and XDR-TB.
So MDR and XDR. So there are two types of tuberculosis, as Deno mentioned before in the beginning, where MDR is the multi-drug resistant TB and XDR is the extreme drug resistant TB. So first, the MDR TB is the multi-resistant tuberculosis, multi-drug resistant tuberculosis, where this cannot be a clinical diagnosis; it must be a laboratorial diagnosis. It is caused by strains of Mycobacterium tuberculosis that is resistant to both rifampicin and isoniazid with or without resistance to other drugs. Because these two drugs are the ones who will cure you from the normal TB, where Deno will explain more about later. And there are second line drugs for curing or treatment for MDR TB, which are, for example, clofazimine and ethambutol. And Deno will mention more drugs later on.
Yep.
But there are a more dangerous tuberculosis out there called XDR TB. There are not many cases about this, right, Deno?
Yeah.
Yeah. So this drug is extreme because it is resistant to many drugs, and the second line drugs of the MDR also that is able to treat the MDR disease, MDR TB disease. So this is resistant to many drugs. The first two main drugs, which are rifampicin and isoniazid, and three more second line drugs which are used to treat MDR TB. So XDR, like 50% chance of surviving it, right, Deno?
Yeah, that's right. We're going to talk more about that, the 50% chance later.
Okay, Deno, now I can take control again. Deno.
All right, let's take control. All right, so we're going to talk more about the XDR MDR TB because it's quite confusing as well. So Anza and I actually have searched so much on the scientific journal, but there are not that many there's not that many explanation on how XDR and MDR actually treated, or perhaps more or less just so basically so complex. So we're trying to shift it so that anyone can understand it without further concept on science study. So here's the thing about the treatments. So I will use this table. I'm going to divide it into two parts of tuberculosis, as I have mentioned earlier, but the drug-susceptible tuberculosis and also drug-resistant tuberculosis. As mentioned, we have MDR and also the XDR. The MDR stands for the multi-drug resistance, and also XDR, extreme drug resistance. Now let's talk the method for the drug-susceptible tuberculosis. When you are having tuberculosis, when you're positive for tuberculosis and you show symptoms, you will undergo what you call as a drug therapy. Now, what this means that you will take couple drugs, medication drugs, of course, and then you will take this drug for a period of time. Like in this case, for drug-susceptible TB, we have the isoniazid, rifampin or rifampicin, pyrazimide, and also ethambutol. And you take 2 months of taking all four of them, and then once you're done, you take 4 months of just isoniazid and also rifampin or rifampicin. I will talk about the side effect and why this treatment is also quite dangerous, and why Anza earlier said the XDR also have a 50% chance of survivability, and the MDR have a lower rate of survivability than the drug-susceptible TB. And then for the MDR, we have to take the four drugs. Now, the reason why we don't take the isoniazid and also the rifampin, well, there are some cases where people actually take the rifampin and also isoniazid, but it won't really affect it because the MDR-TB, as I mentioned earlier, when someone didn't take the medication, basically someone actually stubborn enough to feel like they're cured after the 2 months medication, so they don't take the 4 months medication for the drug-susceptible TB. What happened was when they don't take this medication, without them realizing, they are actually harnessing, or like they're basically making it easy for the tuberculosis bacteria to develop and to mutate. And when they mutate, they become drug resistant to the isoniazid and also to the rifampin. That's why we don't use it here for the MDR. Instead, we take the clofazimine and then ethambutol, the same one for the first one, and then pyrazinamide, and also fluoroquinolones. Fluoroquinolones. It is a very slip of tongue. I'm sorry. A drug therapy. So basically, we take 9 months for this all medication, which is not, which is a higher, which is quite longer than the first one, the drug susceptible. For the drug susceptible, we only take 6 months, basically 4+2. And now for the MDR, we take 9 months of this 4 medication. Now for the XDR, I'm going to talk more on the XDR after this next slide. So basically, we don't take this drug that we just mentioned before. We take a second line drug. Basically, it is more, have more side effect, more severe side effect, and we have to take it for 2 years. What is the side effect? Okay, let's take a look at here. So I have this table here. I don't know if you can see it, but I hope you can see it there. So we take the amikacin and then the capreomycin and also kanamycin. So let's take a look at here, the amikacin, the third to the last. We have the side effect, diarrhea, hearing loss, vertigo. Vertigo basically when you're feeling kind of like dizzy and you lose your balance, and then you feel just like want to pass out. And then skin tingling, muscle twitching, ringing in the ears, and then also much more. And then we got to the capreomycin, which is the swelling, rapid weight gain, and more in there, bruising, muscle weakness, and more. And then kanamycin, change in hearing, spinning sensation, and more. You can read that one. But basically, the bigger line here, it basically have a more side effect than to the first line drug, for example, isoniazid and also rivampin. Let's look at the isoniazid and rivampin here. The most severe one is basically hepatitis, and the hepatitis is basically have a symptoms like, for example, the loss of appetite, nausea, vomiting, fatigue, and rash. For those of you who are familiar with nausea, nausea is when you're feeling quite like you want to throw up and you don't feel quite well. That's basically what nausea is. Now, this is the medication. So that's good. This is why, as I said earlier, you have 50% chance for people who have the XDR TB for survivability. Survivability. So imagine taking these 3 second-line drugs here, the amikacin, capreomycin, and also kanamycin, taking it for 2 years, and then after that, developing the side effects. Of course, you will feel your body will soonly give up. So you have a 50% chance of either your body will take it all in and then finally cured it, or your body might give up, and then you will definitely be in a more severe case than just tuberculosis. And then after that, we're going to talk about homeopathy. So it's a very quite strange concept of homeopathy. Basically, it is technically like medication by using a natural drug. So we'll talk about the natural drug for tuberculosis after this. And some also believe that homeopathy is basically the study of science in which they believe, they by meaning scientists believe, that the body can heal itself. So it's quite a strange concept for homeopathy, but I'm taking the case from Dr. Kusum S. Chan. She is a doctor in the Tame Inc. I forgot where it was, but it's basically in the Tame Hospital. She has a patient who suffers from the drug susceptible TB, drug susceptible, not drug resistance. But she wrote a book along with other colleagues, and it's called the Homeopathy, the Preparation for Tuberculosis. So in this book, he has a patient who should remain nameless. It was a patient, a female patient, age 37. She is suffering with drug-susceptible tuberculosis. But when she take the rivampin and also the ethambutol, she suffer a loss of eye vision and also sort of like trouble with the hearing. And then and then the patient complains about the irritation in the eyes from the ethambutol. So she take another approach to the tuberculosis by homeopathy. So this is the medication that she used. She take the tuberculinium bovinum. This is the common homeopathy medicine for tuberculosis. You take the 200C of the tuberculinum bovinum. I one dose once a week on Sunday and morning, and then you can see more in there. Natrium moraticum 200C, one dose twice a week on Tuesday and Friday morning. So it's more like on a daily basis, but different drugs used. So instead of taking the 4 drugs mentioned earlier for 6 months, the patient, the 37 years old patient, actually take her medication and heal in the course of 2 months, which is quite amazing. Because last side effect for the medication that Dr. Kusum approached, and she actually healed faster than just normal tuberculosis medication. But though it is still on the experimental states, the homeopathy for tuberculosis, if you're unlucky, you might experience more symptoms such as skin rash or skin irritation, in which the case, or Dr. Kusum actually have another case for homeopathy where she used the same medication to the person, but it get worse. So yeah, it's still an experimental state. Uh, yeah, but basically there are some cases where homeopathy works on tuberculosis, as I mentioned before. Prevention. Now this is when we talk about vaccines. Anza, let's go to you.
Okay. So the use of vaccines is to prevent, right? Prevent young children or infants from getting any disease. But in this case, it's the tuberculosis disease, where the vaccine is called the BCG vaccine, which produces an immune response that partly protects infants and young children from serious forms of tuberculosis, as I mentioned before. And this BCG vaccine is prepared from weakened strains of Mycobacterium bovis. And as you know, M. bovis is one of the pathogens that causes tuberculosis, where you get it from fresh meat, as Deno said before, and bad milk also. And this is called the BCG vaccine due to it being discovered by a French bacteriologist called Albert Salmit and Samuel Guerin. I don't know if I pronounced that right, but it's okay. CG from the Calmet and Guerin, last names of the who discovered the BCG vaccine. And this vaccine usually takes a lot of time to develop, right? But the BCG vaccine is created in only 13 years in the time span of 1908 till 1921. And till this day, the BCG vaccine is still used to prevent infants and young children to not get serious cases of tuberculosis. Alright.
And like we talked about the anti-vax movement earlier, well, they don't. Basically, some of them didn't take the vaccine for the children, and you already heard from Anza himself. It is severe if you don't take the vaccine. It will be easier for the tuberculosis to infect the infant or your child. So yeah, I don't really approve of the anti-vax movement. How about you, Anza?
Nope.
It's a big no-no. Alright. Next one. What do we have next? Hold on, sorry. Oh, my bad. And that's basically severe for the tuberculosis patient. Now back to you, Anza.
Go back to me. It's your slide, bro.
Okay, just cut that one up and then you
get my slide there.
Still your slide.
Okay. So now we're gonna talk about the impacts around the globe, but now we're gonna focus to our country first, our beloved country, Indonesia.
Mm-hmm.
And before I show you facts, I'm gonna tell you a fact first that Indonesia is actually the third most country in the world with the most cases of tuberculosis. Where, wow. Me and Deno, when we first discovered this, we were really in shock. Because in 2018, the data of people infected with this disease, the pathogens M. tuberculosis and M. bovis, in their body is around 850,000 people infected based on the 2018 data. As you can see, there's the TBC situation picture that we got from the internet. And from that percentage of from that number of 850,000 people infected, 6% or 5.9% of it died due to TB, which is about 50,000 deaths, as said on the PowerPoint, based on the 2018 data. And many journals, after Jokowi talked about the TBC prevention and that Sudirman, that Jokowi just knew about the General Sudirman having TBC. And now many Indonesian websites are making articles about TBC and how and why is it dangerous and more dangerous than the coronavirus. Where the headline of the article, the title, is shown in the PowerPoint. which says orang Indonesia harusnya takut TBC bukan virus corona.
Mhm.
Because it spreads easily, it's more dangerous, and it affects the lung. That's the first infection point, and it will spread for about 1 to 2 days, right there,
Yeah.
the spreading. And that's the TBC condition in Indonesia, where thank God that the quarantine happened, so the tuberculosis disease won't be more spread, and that now we're in quarantine, so there will be no more interaction between people, so there will lessen the cases of tuberculosis in Indonesia.
So it's basically a win-win situation. We save from SARS-CoV-2, and then we're safe from tuberculosis. So it's a win-win situation.
Win-win.
So
Okay.
I'm going to talk about more a little bit here. So don't really go into the website and then check for the number. You kind of have to do it the math yourself. Most of website actually have a different number of deaths for tuberculosis in Indonesia. Some article says it's a 1 million deaths. Another one says 500,000 deaths, and then the other one says 67,000 deaths.
500,000 deaths.
100,000 deaths, which is amazing. So Anza actually done the math. So we based on the data for 850,000 infection, and then for the number of people that actually survived tuberculosis and those who didn't. So Anza done the math, and then from taking the entire data and then try to find the middle ground for it, we came up with the fixed one, which is from this article. It's a 50,000 death in Indonesia.
Wait,
Then,
if we based it on that in the picture in the table that we put in the PowerPoint, it says 85% is healed, right? Cured by the drug treatment. 85%. So that's about 222,500 people being cured by the drug treatment. That means that 127,500 people are left uncured or dead. So that's why we concluded on a number of 50,000 deaths. So that's more reasonable.
So that's basically how you should actually think about the data, because basically with this whole SARS-CoV-2 things, we can't really trust the media that much. So we kind of have to do our own research, right, Anza?
Yes.
So yeah, we need to do our own research for this one. Next one. Okay, I'm trying to make sure that I don't mess the entire slides here again.
Take control, Deno.
Okay. Does it work? Okay, it works. Okay, there we go. So we're going to talk about the world here. So basically, the red color here shows the cases for 300 or more 302 or more cases of tuberculosis. This, of course, the counting also for death by tuberculosis and also those who cured for tuberculosis. And this is the case for 100,000 population. So you can see from the color code here. Now, there's a pattern here in Africa, especially in the tropic and the subtropic area. So I'm taking the example for Nigeria here. Now let's take a look for Nigeria. So this is taken from the PacificPrime.com. This is reliable. This is also one of the data that we take for counting the number of deaths by tuberculosis. So it is said that Nigeria has the lowest doctor-to-patient ratios worldwide. So what that means is, in basic math, you have a low number of doctors while there's hundreds and more people to be cured with just a low number of doctors. And then the next passage is, with shortage of healthcare staff, medical equipment, and basic medication, more than half of Nigeria's population has limited access to healthcare service. Now, it is bad enough, but it won't be that bad if the number of corruption is not increased, right? Overall, the Nigeria's corruption number is actually at high. It's also taken from PacificPrime.com. They basically mentioned that the corruption for the Nigeria is actually at high. And then they have a weak legislation. They have the weak anti-corruption legislation. So while the citizens of Nigeria is in battle against tuberculosis, they are also fighting against corruption. And this too is basically these are the two enemies that they are facing right now. And they're actually having help from the United Nations. basically the nation is on a move to face Nigerians' corruptions. Uh, and then after that, with these two factors, where there's a low doctor to patient ratios and then the shortage of healthcare, they are not, I mean, the Nigeria, as well as other low income countries with the same cases, they are unable to provide the citizens with vaccines, let alone cure. They, they actually have a shortage of it, and RUM, the rational medications, rational usage medication. It is basically part of the United Nations criteria for country who actually have the decent amount of healthcare. It's not applied in Nigeria because Nigeria is still at a low state right now. They don't have that healthcare that they need, especially with the whole tuberculosis and then more disease coming on for them. So it's basically very sad to see that they are not able to get the healthcare that they need. And also for the government here, it's shown that they are having a high corruption number. It's just outrageous, you know. So I hope their problem can be resolved. And that is about in the low-income countries and factors around the world. We are coming in the end of our slide 30 of 30. I'm sorry for the error in the middle of the presentation. I'm sure Anza have edited that one up or whatnot.
I don't know. Yeah.
So if you're interested, you can actually get our essay about this topic. You can't really use the you can't really use the presentation because there's not much to read. We just use this as our basic. But I'm sure you can get from Mr. Nunu my essay or Anza's essay about tuberculosis. It's called TB or not TB, which is cool. Alright. That is the end of our presentation. About what we can hear from SARS-CoV-2 and also tuberculosis is that please quarantine yourself, and learning from tuberculosis, it is serious. If you are not following the basic train for the quarantine and also self-isolation, dude, the entire tuberculosis thing is going to happen again. So please don't.
But
Learn from it.
if TB comes up again, I will not be surprised because we're the third highest number of cases in the world. So
At least we know we're the third highest, so we know like, okay, we need to turn down here. we need to make change.
quarantine. Okay, so that's the end of our slide of our presentation about tuberculosis.
Mm-hmm. If you have any questions, text us.
Okay.
Online.
So my
We're
name is
for-
Anza, and this
My
guy
name is Deno.
is Deno. Thank you
Yes,
for watching. Yeah?
Thank you for watching.
Like,
Is it
comment,
video?
subscribe.
Like, subscribe, comment.